In the 1970s, in the early days of my career as a physician, I was studying viruses, and in particular, herpes viruses. There are a number of herpes viruses that are sexually transmitted, and therefore, much of my research was on sexually transmitted diseases. These were diseases that were never mentioned in the media during those days, and also were never mentioned in polite company. Because of my research, I was recruited to the Centers for Disease Control and Prevention in Atlanta, Georgia, that's the CDC, to become their herpes expert. And I worked in a unit called the Venereal Disease Control Division. Several months after my arrival, the TV program 60 Minutes asked CDC if I would be on their program to discuss herpes virus infections. CDC agreed, and in a few weeks, a crew from 60 Minutes came to my office, and for 4 hours, they videotaped an interview. Afterwards, the CDC was really worried about how 60 Minutes would portray our organization. But I was worried about what my mother was going to think. My mother was in her 70s. She was a very religious woman, and she knew I was working at CDC, but she didn't know the details of my research. So I told her I was going to be on 60 Minutes, and she was delighted. She told her church group, her senior citizens group, and all our relatives and friends, including those in Ireland. On the day that the program was aired, the first question that was asked me was, Dr. Guinan, which venereal disease would you least like to have? Since I wasn't asked that question during the interview, they made up an answer for me with clips from the videotape, which showed me talking about gonorrhea, syphilis, and genital herpes infection. As I watched, I cringed. After the program was over, my mother was the first to call. And she said, "Congratulations, dear, your hair looked very nice." Now, she couldn't deal with the subject matter, but she found a way to give me her approval. After that, I never worried about what people thought about my work in sexual matters, but I knew I had to find a way to be able to talk about these diseases in a way that was acceptable to the community. How did I get here to where I am now? After I finished medical school and postgraduate training, I became aware of the worldwide effort to eliminate smallpox from the world. Imagine, the World Health Organization convinced every country in the world to be part of it. And if it was successful, it would be the first time in history that a deadly disease would be eliminated from the world by the design of humans. There were a lot of naysayers. Many people believed it couldn't be done. I decided to be a believer, and I volunteered and I signed up for service. I was accepted into the program at CDC that trained participants to be medical epidemiologists, also called medical detectives, who investigate and control epidemics throughout the world, all kinds of epidemics throughout the world. After months of training, I was sent to the smallpox eradication program in India. I was there for over 4 months. It was one of the most exciting experiences I ever had in my life. 2 years later, in 1977, the world was free of smallpox. It was exhilarating to have been a part of that successful program, and it convinced me that my future career would be in public health and in preventing disease and illness. But there was a downside to my time in India. I worked in some of the most remote areas of northern India, where the plight of women was unimaginable. A woman usually had a baby every year, even though she and her children were malnourished. There was no access to contraception, and often the women died in childbirth. The smallpox eradication program could provide protection against smallpox, but much more was needed to improve the lives of women. When the AIDS epidemic emerged in 1981, I was part of the task force that investigated the first cases of AIDS. It was a very difficult time. As the epidemic spread, fear and anger really engulfed the nation. The government was very slow to respond, even though hundreds of people were dying and thousands were suffering. The lack of a national response and the vilification of AIDS patients spawned an outcry from gay organizations and their allies. They demonstrated all over the country and challenged our leaders to find treatments and health care for those afflicted. The movement was unbelievably successful. It is a wonderful example of what we can do in the United States. Rise up and demand that our elected leaders be accountable and deal with whatever crisis is ongoing. I continued to work in the AIDS unit at CDC for many years, and I also worked in a local AIDS clinic in Georgia, where I cared for many women AIDS patients. In the early years, there was no treatment for AIDS, and so that many of my patients would die within 2 years. If a woman with AIDS was pregnant, there was a 30% possibility that the AIDS virus would be passed down to her newborn. And yet, there was no provision in the clinic for prevention of pregnancy. I could prescribe birth control pills, but the women didn't have the means to buy them. Some of the women became pregnant and infected their newborns. The guilt that women felt for infecting their child often overwhelmed them. And on their deathbeds, their sole concern was finding a future caregiver for their infected child. The needs of women with AIDS to prevent pregnancy were completely ignored, resulting in large numbers of infected infants. For 15 years, there was no effective treatment for HIV/AIDS, but finally, in 1966, a cocktail of drugs was found to be very effective. It was like a miracle. People went back to work, they were getting better, they were living close to normal lives. But the clinic still did not provide contraception for infected women. My experience for caring for low-income women for more than 20 years led me to become an advocate for access to safe and effective contraception for all women of childbearing age. And now I want to talk about the tragic opioid epidemic spiraling out of control in the United States, and the thousands of babies that are being born addicted, and what we can do to prevent these addicted babies. The opioid epidemic is the deadliest drug epidemic in the history of our country. We have no vaccine to prevent addiction, nor do we have a cure or even a reliable treatment. This year, over 2 million Americans will suffer from addiction. Many women opioid addicts have babies that are born addicted. The cost to treat an addicted baby averages approximately $60,000 just for the first few weeks of life. Right now, in the United States, an addicted baby is born every 15 minutes. Every 15 minutes. This means 35,000 babies, addicted babies a year, with medical costs of over $2 billion annually. Most states pay for the treatment of addicted infants with federal Medicaid money. The infant is usually taken away from the mother until she's clean and put in foster care. The state pays for the foster care of the addicted infants, maybe for years. But it's not just the money. We have to prevent the agony of newborn going through withdrawal in the first few weeks of life. There's no standard protocol for the treatment of addicted babies, so that doctors have to guess on how to relieve the pain and suffering. We know how to prevent addicted babies, but why are we not doing so? I imagine that most of you here do not know what a LARC is, because I didn't know what it was until about 2 years ago. We now have a group of contraceptives that are safe and almost 100% effective in preventing pregnancies. These are called LARC, L-A-R-C. LARC is an acronym for long-acting reversible contraception. I'll say it again, long-acting reversible contraception, a LARC. LARCs are methods of contraception that prevent pregnancy from 3 to 10 years. There are 2 main types of LARC available in the United States. One is an intrauterine device, or an IUD. The other is an implant. A trained medical professional inserts the LARC. The IUD is inserted into the uterus, and the implant is inserted under the skin, usually in the upper arm, underside of the upper arm. Once a woman gets a LARC, she doesn't have to worry about taking pills or convincing her partner to use a condom. She will be protected from pregnancy until the LARC is removed. LARCs are close to 100% effective in preventing pregnancy. And therefore, they can be close to 100% in preventing addicted babies if provided to addicted women. There are other types of contraception available, but they are not so effective as a LARC, mainly because they are not used consistently, and drug addicts are unlikely to consistently use contraception. The efficacy of LARCs is extraordinary. Medications or devices used for medical conditions are rarely even close to 100% effective. I first heard about LARCs a few years ago while driving with colleagues in rural Clark County, Georgia. We passed a large billboard with a sign that said, "Have a LARC in Clark." There was a photo of a woman physician and her staff all smiling. I asked my companions, "What's a LARC?" None of them knew. I didn't know. When I found out that LARCs were long-acting contraceptives, I thought how ingenious that bulletin board was, mainly because it avoided the use of the words birth control. Birth control is a hot topic in our country and is very controversial, with strong opposing sides. For many people, the word birth control means contraception and abortion. LARCs are contraceptives and do not cause abortion. So the billboard was very clear. It was not birth control, it was long-term contraception, a LARC. But we know that contraception is very difficult to talk about. Maybe it'll be easier to talk about LARCs. I believe that most of those who oppose abortion are not opposed to contraception. And I believe that if our elected leaders knew that addicted babies could be prevented, they would be willing to provide LARCs. It is time to stop ignoring the needs of addicted women to prevent pregnancy. And it is time to start talking about LARCs. Our Constitution gives the states, not the federal government, the authority to provide health care for its citizens. That is why access to health care and contraceptives varies so much among the states. Many states do not want to pay for contraception. Even though they can use federal money to provide LARCs, they do not. LARCs have been shown to be effective when used in a crisis. During the Zika virus outbreak in 2016 and 2017, a groundbreaking study was done in Puerto Rico, the area of the United States where most heavily affected by the Zika virus. Zika virus can cause serious birth defects if the pregnant mother is infected. To try and prevent these infected babies, the Puerto Rican study group offered LARCs and other contraceptives to all women in the study area who did not want to get pregnant. Over 150 healthcare professionals were trained in providing LARCs, which were absolutely free for all women who participated. In a short period, over 20,000 women received contraceptives, and 68% of them chose LARCs. The study is still ongoing, but there is no doubt that LARCs were effective in dramatically reducing pregnancies and infected babies. Preventing pregnancy is key to reducing both babies with birth defects and babies with addiction. Preventing pregnancy is the key to prevention. We must start making LARCs available for all addicted women during the opioid crisis. The opioid epidemic has been declared a public health emergency, a national emergency. We really don't know how best to prevent addiction, nor what form of treatment is most effective. But we do know how to prevent addicted babies. LARCs are expensive, approximately $800 to $900 each. But they can last from 3 to 10 years without further costs, and they are cost-effective in the long run. The $60,000 saved for preventing one addicted baby can pay for over 60 LARCs. Medicaid should require each state to use some of its federal funding for prevention of addicted babies, but they do not. So the states have to make this decision. It is your state legislators who are making the decisions on how the money allotted for the opioid epidemic will be spent. You can influence how that money is spent in your state. Become a believer. Help your governor and your legislators to get over their reluctance to talk about contraception. Tell them about LARCs. Tell them it's a national emergency. Send your legislator and your governor a letter, or call them and leave a message, or send an email or a tweet. Tell them about LARCs and how they prevent addicted babies. Ask them if they are using opioid money to prevent addicted babies by providing LARCs for addicted women. And if they are not, ask them why not. We have to start the dialogue. I expect very few governors or legislators know about LARCs. 75% of state legislators and 85% of all governors in this country are men. Who will educate them if you don't? Let them hear your voice. Tell them what LARCs are and how they can prevent addicted babies. Hold your elected leaders accountable. We need both men and women to do this. Addicted babies are not just a woman's issue. They are a men's issue, a family and community issue, a state and national issue. Start the LARC conversation. Remember, an addicted baby is born every 15 minutes in the United States, and you can do something about it. You can help prevent addicted babies in your state. You need to do your part. We need you to do your part and ensure that all addicted women in your state have access to a LARC. Thank you.